Hi, this is Dr. Apoorva, Senior Registrar working in Dr. T.M.A. Pai Hospital. I would like to talk about dengue today. Dengue is a virus which is caused by the mosquitoes, that's a Aedes mosquito. Dengue fever is very common during the monsoon season, usually increases during the June to September, usually featured by presence of fever, which lasts usually for 1 to 3 days in the starting, which is frequent fever present around 3 to 6 hours, which is temporarily relieved by the tablets, that's a fever tablet. After that, next phase of it is called the critical phase, which usually the fever stops, but the platelet drop is usually seen from the first day of the fever. The platelet drop can be vary from person to person. Sometimes the platelet drop may be very severe, going less than 1 lakh also. That is when the more critical phase is starting along with that. The drop in platelet can be associated with the other symptoms of body pain, chills, along with that rashes and this one. But the more important part comes as a warning signs, which is usually precipitated with abdomen pain, or there can be also gum bleeding usually, which is seen in the gum bleeding, nose bleeding, or a urine bleeding also along with that. These signs usually means the platelet has dropped significantly, which will require admission and require further treatment along with that. During the dengue season, the preferred treatment is one is the fever reduction, another is hydration. You need to drink around at least 2 to 3 liters of water per day for the dengue virus to go away from the body and also for the health to be improved along with that. Regular platelet monitoring is also better to be done every once in 2 days or once in 3 days, so that if the platelet drops very fast, the further treatment can be started earlier. The warning signs which I mentioned right now in dengue as a bleeding or a low BP or a dizziness, these all usually precipitate the dengue infection. So these signs are where you need to come to hospital and get treated for the same along with that. Hydration is the main important part of the treatment. So drinking about 2 to 3 liters of water per day will definitely benefit. Water also can include other liquids like a tender coconut water, and also a good amount of fruits like a kiwi, papaya, which can improve the platelet count, also will help along with that. Next, coming to the other part of the dengue, once the admission occurs, the other treatment also includes the fluid and rest. Rest requires at least 3 to 5 days of rest would be beneficial along with that, which will help in improving the treatment of the dengue along with that. This concludes the entire dengue treatment along with that. Thank you.